So chikungunya. Now the name sounds like as though something to do with chicken. It's got nothing to do with chicken. Okay. It's got nothing to do with chicken, so don't get confused. This is a new disease as far as India is concerned, as far as we are concerned, but it's been there for some time. So it's caused by an alpha virus that spreads by mosquito bite from the Aedes aegypti mosquito. Okay. So what else does Aedes cause? Any idea? What else does Aedes bite cause? Dengue. Yeah, dengue is caused by Aedes bite. So here, this is also caused by Aedes bite. So here what do you have? Symptoms are muscle pain, headache, nausea, vomiting, fatigue and rash. Many of the things are common to other illnesses also. Okay, so it's very non-specific and we have some issues identifying it. And the common risk factor is mosquito breeding places. So this is first isolated in the year 1953 from serum and it's called chikungunya and it has an incubation period of 2 to 4 days. So this was where chikungunya was basically African side. Okay, then it came to South India. So this is how the track of chikungunya looks like. It started in 52 in Tanzania, Africa. Then it went to Malaysia. Malaysia it went later. Then it went to French Reunion Islands where a massive outbreak occurred. Then Mauritius. Then Madagascar, Mayotte and Seychelles. Basically around the African belt. Except for that, yeah, except for this. But it landed up in India also. So this chikungunya comes from this word from a word which means that which bends up. So that is because of the intense pain that it caused to joints. So it's a Makonde word. Makonde is an African language. So it means to bend forward. Okay. This is described by these people. The thing is, chikungunya is not considered to be fatal. Very rarely you will find somebody dying of chikungunya. Almost nobody. It's not the case with dengue. Dengue, a lot of people die. So then in India, after Africa, how did it land in India? India it first came in 63. Then in Andhra Pradesh, 2006, then also in Nasik and North Karnataka. So, till 2006, we were unaware of chikungunya. Nobody knew what was chikungunya. After 2006-07, I first heard a term myself. When I was working for WHO, I went home, I met a relative, he said, I was admitted to the hospital with chikungunya. I said, what? He said, chikungunya. I said, diagnosed? Yes. That was the first time I knew that chikungunya entered India. Okay. So, it was not a new entity. It landed in South, it landed in here. So, we've had cases in 2006 also. So, this is a classification of the virus. The alpha virus, Tocoviridae family. Agent, host, environment, mosquito, man, and the environment. This is a virus, looks like this. And it's usually transmitted by Aedes, not by that much by Culex and Mansonia. And this is how your Aedes mosquito looks like. Also called, this is given here, orals, also I mean your practical exams as a spotter. Identify the mosquito. Also called tiger mosquito. So where does this Aedes breed? Where does the Aedes mosquito breed? Now we've all had mosquito bites. So Aedes breeds in certain places like clean water, in all stored water for drinking, washing, bathing, rainwater which is collected in coconut shells, flowers, plastic cup, mud pot, etc. All these you find Aedes mosquito breeding. These are some of the sites. Okay, inside tires, inside broken wells, inside coconut shells, inside these things, tankers. These are some other familiar sites where you find Aedes mosquito breeding. So, Again, very common places where you have mosquito breeding, particularly Aedes mosquito breeding. Okay, broken pots, broken cups, martyr hard, all this you can have Aedes mosquito breeding. So the host is man. The main reservoirs are sometimes can be primates, that means monkeys, and birds and animals also can be, mammals can be affected. Now, Aedes bites during the daytime. We normally feel that mosquito bites in the evening. No. Aedes bites during the daytime. It's also an aggressive biter. Whereas Anopheles bites usually in the evening. Okay. Mosha bicale kample, that is not an Aedes mosquito. So major activity is sunrise and sunset. After sunset, it normally doesn't bite. So what about the environment? What is the reason for the Aedes to flourish in the environment? First is population increase, new buildings are coming up, deforestation, global warming, floods, competition for food, fast movement of population. All this contribute to increased breeding of mosquitoes, particularly Aedes. So that's how the environmental factors come into play. And unplanned urbanization. Say if you had a population of 10 lakhs in a city that has gone up to 10 million with no proper planning. The city is gone, but there's no proper planning. Like for example, Bangalore. Bangalore is supposed to be the fastest growing metro, etc., etc. But outskirts of Bangalore is just miles of traffic jam. Same thing with your NCR. Anybody from NCR? Anybody from Delhi NCR region? Nobody? Who? Anybody from Delhi? Nobody from Delhi. So Delhi NCR region again, hi-fi place, Gurgaon and all these places. But that also has got its own problems. So here is improper, inadequacy of sanitation, improper disposal of garbage, development of resistance to vectors to insecticides. So here, what happens? Mosquito picks up the virus, gives it to another person, and that mosquito will in turn will bite another person and give it back. So an infected person cannot spread it directly to another person. That means if I have chikungunya and I shake hands with him or touch him, I will not be able to spread it to him. It will not spread from an infected person to another person. It has to go through a mosquito. But if the mosquito bites me, then bites him, he can transmit he can get Aedes. I mean chikungunya. Okay. So what is the symptoms? Headache, fever, petechial maculopapular rash, joint pain, severe joint pain, a headache, conjunctival effusion, and your slight photophobia. Slight photophobia means he doesn't want to see the light. Okay. This we have talked about. Yeah. Another thing is that, sir, there may be high fever, headache, insomnia, and then joint pain. Now, usually what happens is, in any fever, you have headache, you have some symptoms. But chikungunya, the problem thing is that the joint pain remains even after the fever goes down. So the joint pain remains even 1 month after he's discharged, he's still saying, I've got pain in my legs. Okay. So this is what is the complication of chikungunya. Usually, I mean the places where it affects. Headache, vomit, fever, back pain, vomiting, nausea, chills. Okay. So how do you diagnose chikungunya? There is a maculopapular rash, but that rash is always not visible, and there is inflammation of the eyes, there is retinal lesion. So how do you diagnose it? By a detailed history. Where has it travelled? Particularly from someone who has not been to a area which is mosquito endemic. Anybody from Jharkhand here? Anybody from Jharkhand? Nobody. Anybody from Bihar? Nobody from Bihar, yeah. Which district? Kaunsa district? Patna. So some places there where apparently there is not much of mosquitoes, but there are some districts, like for example, not very far from this place, this Garhwa and all in Jharkhand, which have a lot of mosquitoes. Similarly in Orissa, anybody from Orissa? Anybody from Orissa here? Nobody. Orissa also has got some place like that. So how do you diagnose it? You do a ELISA test to measure the specific antibody. Okay, this is a rash. This part is a maculopapular rash on the leg, but it's non-specific. Just don't look at the rash. It may not be fully specific, but the diagnosis is by IgM antibody titer. Okay, ELISA or PCR reaction. This is the detection of antibodies in the blood. This is only a diagnostic test. So as I said, in 2006, till 2006, we never knew about this virus. After 2006-07, the kits and all started coming. We could detect it by ELISA and PCR. So differential diagnosis, obviously dengue comes in. Other things like West Nile fever, on-young fever, all this stuff comes in. Mainly dengue comes in. Okay. So here, usually, chikungunya is a very mild form. But sometimes you have meningoencephalitis. Sometimes there is also mother-to-child transmission, which was observed in French Reunion Islands. Very rare. But generally, for all purposes, chikungunya is not fatal. Okay. So self-limiting usually lasts for 1 to 10 days. However, the arthralgia, it is a joint pain, can last for weeks or even months. And there can also be epistaxis, bleeding on the nose or bleeding on the mouth, gingivitis as complications. But these are rare. Now what is the treatment? There is no treatment at all for chikungunya. No treatment, no vaccination. So what to do? Supportive treatment. Analgesics, antipyretics, fluid supplementation. So will that alone do? No, it won't. So treatment, there were vaccine trials tried out, but since it doesn't affect so many people, it is no big deal. No point doing a study on some disease which that doesn't affect many people, which does not cause any fatality. So what is the point? So they abandoned that vaccine thing. Then movement and mild exercise. Heavy exercise may exacerbate rheumatic symptoms. So you have to be careful in this. And aspirin NSAIDs has given promising symptoms. So basically symptomatic treatment, a bit of joint movement and supportive treatment. Okay, there is no vaccine. Chikungunya gives a lifelong immunity to that person. How? Means if he gets it once, he won't get it again. Okay, so this is some academic stuff we won't go into. How do you prevent it? Prevention of stagnant water at the home. You cover all your uncovered pots, flower vase, other pots, etc. Make sure there is no stagnant water. Use insect repellents. Use mosquito nets. Use screens. Wear long sleeve clothes or light shade for protection against mosquitoes. Cover all water tanks. Now this is important if you have a flower vase or aquarium or some fish bowl or something. So it's important that you cover it. Second thing is getting rid of any container that has water in the outdoor surroundings. Use tires, food cans, garbage, saucer under flower pot, etc. Renew water in flower vases at least once a week. Many of us like to do gardening, have a few pots in a balcony perhaps or in the house. But you make sure that renew the water in flower vases at least once a week. Control, Aedes species, you control it. Source reduction, you require community involvement also in this. You just can't do it yourself. The people around you are not good enough. You may not eliminate other breeding places also in and around houses. Biological control, they say that introduction of guppy and gambusia fish helps in reducing the larvae. And anti-mosquito measures, use organophosphorus pesticides, abate. Now the problem with pesticides is, what is the problem with pesticides? What is the problem with pesticides? Huh? What is the possible problem with pesticides? Bolo. Or spraying. What is the problem? No problem. So I'll come to your house and hostel and spray. It's okay. What is the problem? Is there a problem with this thing? Is there any problem? Huh? Okay. What is the problem? No, conventional term. Is there any problem with this insecticides spray? Basically, it's a bit toxic to people. Okay. So it's not easy. So you want a mosquito, you want to get some fresh air. So it prevents bleeding, but it does not affect, this is one of the good ones. It does not affect man on the taste of water. Then you have spraying or fogging with malathion. This is successful in reducing densities more than 98%. Ultra low violet fogging about 10 days apart. Okay. So here, what is your role? This is basically, you can't do anything yourself. You have to involve the community. We'll not go into that. It's basically, for all purposes, chikungunya is a preventable, it's not preventable, but it's not a dangerous disease. Okay. Self-limiting disease, very few complications, but no treatment, no vaccine. So, however, a person with chikungunya fever should limit the exposure to mosquito bites in order to avoid further spreading the infection and should use a mosquito net. Again, pregnant women and children below 12 should consult a doctor before using a repellent. Okay, many repellents have certain mutagenic and carcinogenic effects. So, repellents and newborn children under 3 months, repellents are not recommended. Instead, insecticide treated bed net should be used. So, this is the code for chikungunya, ICD 920. But after 2007 or rather 2010, no major cases of chikungunya have occurred in India. No reports have come. So, this is all regarding chikungunya. Okay, we'll go to the other one now. Slightly more difficult, more important, and very important. If chikungunya was not at all important, dengue is very, very important. So, what is dengue caused by? Any idea? Dengue is not caused by Egypt. What is dengue caused by? Naam suna hai? Achha, theek hai. Okay. So, this is the worldwide distribution of dengue as in 2005. There are updates also. But you can see here, North America has spared of it. The main thing is Africa, Indian subcontinent. Okay. So, multiple epidemics have occurred. Now, once again, regarding dengue, when I was small, studying in Calcutta, used to have fever and all this stuff. But dengue, I heard it when I was first in class 6 or 7. I heard that one of my uncles had dengue before in the 60s. And it became a big thing. So, the name was funny, dengue. What is dengue? I was in class 6 or 7. What is dengue fever? We never heard of it. So, dengue fever. Then much later, you'll find that it was first reported in Calcutta in 60s. Okay. So, this was, first outbreak was in 1812, but after that, Calcutta, 1964, that was the outbreak in which a lot of people were affected. That was the first time we heard of the word dengue. Okay. Till then, there was no, what is dengue, nobody knew. And then after that, Delhi, 67, 70, 82, 96, and also other parts of the world. So here we have categories, we have different, India's category B, India, Bangladesh, Maldives and Sri Lanka, category A, Indonesia, Myanmar and Thailand. There they have dengue in more severity, and you'll be surprised to know one of the treatment for dengue. This is very interesting. I'll tell you that, just remind me what it's going to be, okay? So this is the dengue endemic areas. You can see everywhere. Interestingly, what is interesting about this? What is interesting about this? Can you comment on the picture? Can you comment on this picture? Green is dengue areas. Non-green is non-dengue areas. Now can you comment on that? What do you mean? What do you see here? Where are the non-dengue states or areas? Huh? North Bengal. Northeast, okay, fine. Northeast? North India also. North India, which parts? The central part, okay. So central part, there are jungles, there are hills, but it's not, no construction activity is going on. Again, northeast, there are hills, Kashmir, that area also is nothing. So here what is happening is risk factors, construction activities. So this is important. Now if you look at this, the cases and the case fatality rate. These are all cases which have been going up. case fatality rate went to this high, then it's dropped down. Okay. But again, like chikungunya, dengue has got no treatment, no vaccine, just supportive treatment and some other treatment. So if you look at dengue's report from newer areas, like you can't see it from there, Delhi is maximum, Punjab, Kerala, Gujarat, Karnataka, Tamil Nadu, Rajasthan, Maharashtra, Haryana, Uttar Pradesh, West Bengal and Andhra Pradesh. Now here is one important issue, that is, how is it that Bengal is having so less dengue cases? Any idea? Why does Bengal have so many less dengue cases? Huh? Why is Bengal having less dengue cases? Any idea? Huh? Why is Bengal having lesser number of dengue cases? Any idea? Okay, we'll come back to that shortly. Okay. So, if you look at the deaths, Kerala has got 16% deaths, West Bengal has only got 1% deaths. Okay, Haryana has got 19% deaths. So, here, what is your observation of these two slides? What is your impression? Bengal has done very well, number of cases less, number of deaths less. What is your opinion? Huh? Drainage system is good. What is your opinion? He's saying drainage system. Bengal has done well, number of cases are less, number of deaths are less. Huh? Huh? Treatment bhalo, I don't know. Treatment bhalo hote pare, I don't know. Anyway, anybody, any suggestions? Out of the box suggestions? Dekhe ki bola? Huh? Huh? Test? You're coming close to the point. Test come hoche, reporting come hoche. Okay, that is the possibility. So this is a slide which was shown in a national meeting, and the West Bengal Health Secretary, somebody asked him how did it happen, and then some others said no, it possibly because your data was, all the tests were not done. Because we were reading the papers that dengue cases are increasing everywhere, but Bengal it was showing a drop. So this was apparently some data mismatch. We could not have this. Okay. So again, 2007, 95 cases. 2007. It goes up to 2012, it goes to 944 cases. Whole of West Bengal, mind you. Only 5 deaths. Only 5 deaths in West Bengal in 2007, 2012. So this is again, people sitting in Delhi, they said, कैसे हो रहा है भाई बंगाल में इतना कम केस कहाँ हो रहा है, दिल्ली में इतना केस हो रहा है. So then again they found that the people are not reporting dengue cases, the government is trying to suppress the figures, etc. etc. Anyway, so this is the thing. So here we have basically 2 forms, dengue fever and dengue hemorrhagic fever. It starts like a small flu, headache, body ache, fever, etc. And the problem is when it becomes DHF, dengue hemorrhagic fever. By the way, have any of you had dengue? Dengue, any of you? 1, 2. Anybody in your family has had dengue? Raise your hands, nobody. Okay, 2 people are there, 2 or 3. Okay. So actually you have undifferentiated fever, specific fever, dengue fever and dengue hemorrhagic fever, which is the most dangerous, and dengue shock syndrome. So this is a danger, last 2 ones are dangerous ones. So it's just like febrile illness, high fever, which lasts for 5 to 7 days, and what they say, break back fever. You feel a lot of pain in the joints. Ato bata lagche, khub bata lagche. Second fever again after 1 or 2 days, fatigue, nausea, vomiting, diarrhea, macular or maculopapular rash, respiratory symptoms like cough, sore throat. Many of the symptoms are common to other illnesses also. The rash may or may not be present. Breakbone fever is there. Arthralgia, myalgia, headache, retroorbital pain. Here, pain occurs here. So, this is one, this is fairly specific. retroorbital pain, pain behind the eyes, muscle pain, joint pain, and these are all rather not very vague, not very specific, but still it gives you an idea about this could be the case of dengue. See whether he's got any pain behind his eyes, he could be having dengue. Then there can also be loss of senses, okay, and measles like rash, nausea, vomiting. Then the problem starts with the drop in the platelet count. If the platelet count drops below 1 lakh, then it's a danger sign. It's a sign of dengue hemorrhagic fever, and then there's also hemorrhagic manifestation with the positive tourniquet test. What is a positive tourniquet test? You tie a tourniquet on your wrist and you see suddenly find petechial spots come. Okay, red spots. You just tie a tourniquet on the wrist of a patient suffering from dengue and you find petechial spots. That means the platelet count has dropped and he may need platelet transfusion. So this is a danger sign. And there's a plasma leakage which may progress to dengue shock syndrome. So this is the signs of hemorrhagic shock syndrome. Symptoms similar to dengue, severe continuous stomach pain, skin becomes pale and clammy, bleeding from the nose. Now remember, a fever patient who's bleeding, please bear in mind that it could be dengue. It can be anything else also, but it can be dengue. If he's bleeding from the mouth, nose, gums or skin rashes, frequent vomiting with or without blood, sleepiness, restlessness, patient feels thirsty and difficulty in breathing. These are some of the warning signs of dengue hemorrhagic fever. Okay. So, whenever you see some case like this, be a bit careful, particularly the bleeding part. If you notice somebody is bleeding, there's a good chance that he could be having dengue hemorrhagic fever. So, what is the agent? Agent is dengue virus, dengue 1, dengue 2, dengue 3, dengue 4. All are widely present in India. It looks somewhat like this. Vector again, it is spread by the bite of Aedes aegypti, which as I told you, it bites during the daytime mainly, sunrise and sunset. And here it rests on singly or on damp surface above the water. It's a daytime feeder and can fly up to limited distance of 400 meters. Okay. So, to get one full blood meal, the mosquito has to feed on several persons, including infecting all of them. Just for my information, do you have mosquito nets in your hostels? Boys' hostel? Do you use mosquito nets? No. Girls' hostel? No mosquito nets. Do you have mosquitoes? No mosquitoes. Yes or no? Hai ki nahi hai? Ache? Ache, but you don't use it. Some of you use it, okay. So, here is it. Mosquito feeds, acquires the virus. In the extrinsic incubation period, it bites somebody else, and that is how the viremia starts. So, man, mosquito, man. So, the man, if he is affected, touching another man will not transmit dengue. He has to get bitten by the mosquito. Okay. So, this is the evidence, the intrinsic incubation period and extrinsic incubation period. So, this is how it happens. It's inoculated by the mosquito saliva, then replicates again, and particularly salivary glands, and then circulates in the blood. The mosquito ingests the blood, again replicates in the mosquito gut, and then goes to salivary glands and again bites another person. So, that's how it goes like. Here's the mosquito, it's bitten this guy, then what happens? This is released in the guy's body. Okay, then it goes to, it circulates in the blood, the mosquito bites again, and then he finally bites another person. So once again, the common breeding sites of Aedes, which I showed in the previous slide, same thing, broken pots, favorite tires, etc. How do you diagnose it? Nowadays we have a lot of rapid tests for diagnosing dengue. We have a card test, we have complement fixation test, antibody test, these are some of the tests. Hemoglobin inhibition test, CFT, and most oftenly this ELISA, IgM ELISA, that is the one that is used. and also a rapid diagnostic test or the CART test. Okay. So here, dengue again, no treatment, just supportive care, antipyretics, but be careful, do not give ibuprofen, give paracetamol, because ibuprofen may aggravate the symptoms. Paracetamol is given in doses, cold sponging can be used, and oral fluid and electrolyte therapy. And patients should be monitored in DHF endemic areas until they become febrile for 1 day. Okay. So without the use of antibiotics. So without use of antibiotics, it should be monitored. Then only we can discharge the patient. Okay. And the stable count should be, platelet count should be more than 50,000. In dengue hemorrhagic fever or in dengue, we get platelet counts up to 10,000. You have to give a lot of platelets rich plasma to revive the patient. By the way, have you seen a case of dengue in the wards? Anybody? Any case of dengue in the wards? Acha. Okay. So here again, no vaccination, no treatment, just supportive treatment. There was a lot of talk about a vaccine which came, but it has not been fully, dengue vaccine and all, still it's the pipeline, it has not been effective so far. And the vaccine, the problem is that it should give protection to all 4 types. Dengue 1, dengue 2, dengue 3, dengue 4. And there are trials going on, but vaccination is yet to take off. Okay. Prevention again, personal protection, clothing to reduce exposed skin, insect repellent, mosquito repellent, coil sanitation measures, which some of you are using in your hostels, environment to reduce vector breeding sites, solid waste management, public education, empty water containers and cut weed and tall grass. These are environmental things that you can do. Biological, target the water containers, try to grow fish like gambusia, then chemical thermal fogging, insecticide treatment of water containers, space spraying, indoor space spraying. Indoor space spraying is another big thing. A lot of people don't like the indoor space spraying because it causes allergy, etc., etc. So then we have this other things like hold community meeting about dengue where it's a problem. Then organize training sessions, invite municipal leaders to participate. Use school children as agents to carry out inspections. School children are very helpful. If you do a camp or something in a school, they'll tell you where the water is kept, how to cover it and all. They're very enthusiastic, not like us. Okay. Organize house-to-house surveys, publicize the activity. These are some things which can be done. Okay. So this is how you can protect yourself from dengue. Okay, in your house. So every other day, change your flower vase. Once a week, clear the leaves. Then clear the garbage and the blockages on the roof gutters. Again here, when not in use, turn over all pails and water storage containers. Store them and under shelter. Okay, cover all these things which are not used to store water. If you're going on vacation, close your toilet bowl, seal off the overflow pipe, cover all gully and flow traps. So these are some of the ways we can contribute to at our personal level, if you're living in a flat or a house, to do this. Okay. So public health, still somebody asked, one of the interesting things is that, okay, let me ask a general knowledge question. Who won the Nobel Prize for his work on malaria? Ronald Ross, okay. Now, Ronald Ross, where did he work? Where was he working? Where was Ronald Ross working? Okay, Calcutta, okay, fine. Now, the interesting part is this is, when Ronald Ross was working in Kolkata, till then, mosquitoes were there before also, right? Nobody's got any idea. Only when Ronald Ross came, he managed to discover that this thing is there called malaria. We don't know the answer as such. I don't know the answer. But one possible reason is that it became well known because the Britishers used to get malaria. Indians never got malaria, or they might have died of malaria, it never bothered them. Britishers, they used to wear shorts and all, they used to get bitten by the mosquitoes, and that's how we discovered it. Similarly, in dengue was not a problem when we were studying. But dengue suddenly became a problem. Malaria is still there, but now we are only hearing dengue deaths, dengue, etc., etc. The kit is there. So if you get it in the kit, it's positive. On the other hand, malaria, you won't hear much of malaria. So many cases of malaria in the paper, you will not get. The reason is that to get malaria, what do you have to prove? What do you have to prove to get malaria? You have to do a blood test, right? And the blood test should show what? Huh? The blood test should show the parasite. Now suppose I'm seeing from this side, I don't see this. Like I can see this writing is there. In my field of vision it's not there. My field of vision is this. So I say no parasite. But she's seeing it, she's seeing this part. So unless you go to that particular part, you may miss it. So the diagnosis in malaria is apparently less, while dengue is going up because the dengue kit is picking more cases. Okay. So malaria is not a big issue as far as public health is concerned, but on the other hand, dengue is an issue, and again increased travel, etc. And everywhere the question comes, any government, they'll ask, what is happening? How many dengue cases you have? What about garbage? What about this? What about spraying? They will not ask how many malaria cases. Now the question is, dengue case kitna hai? Whether in Delhi, whether in Mumbai, whether it's in Calcutta, anywhere. Because of this. Malaria is on the other hand, you have to look at a particular slide. Okay. So that's all. Thank you very much.